So what definitely is new that we also incorporated the topic of hydration in the guideline, as we have already done in the geriatric guideline. If you like to read more details than you find in the dementia guideline, you will also find it in the geriatric guideline, in the practical guideline, which is also included in the guideline app of Espen, which I strongly recommend. And this is particularly important for dementia patients because they are at high risk of dehydration, and dehydration frequently is forgotten, as we have done it in the previous guidelines. But now it's included, and I think it's quite fine. The other thing that's quite new is that we recommend a medication review. Previously, we recommended just to eliminate specific causes of malnutrition, but now we precisely also include the recommendation for medication review, which is also particularly important for dementia patients because the medication does not only put them at risk for malnutrition, but there's also medication that could lead to a further decline of cognitive function. So you have a double importance in these patients. And another recommendation that is new in this updated version of the guideline is that training, you could call it eating rehabilitation, is included as a recommendation because there's some evidence that in midterm and late dementia you could improve their ability to have normal meals by training the functions you need for normal meals. So important is the recommendation about screening of malnutrition and monitoring of body weight in a very early phase of the disease, at beginning with the diagnosis of the disease, because many of patients developing Alzheimer's disease have already lost body weight prior to the onset of the dementia syndrome. And these patients will continue losing weight, and that's why it's particularly important to start very early, because then you have the possibility to manage nutritional state by non-invasive means. Because in late stages of Alzheimer's disease and other forms of dementia, we do not recommend artificial nutrition by, for instance, PEG tubes as a regular mean, only as an exception. And what is also important is that there is no recommendation for disease-specific supplements like vitamins, unless there is an indication for vitamin deficiency, or omega-3 acids or disease-specific oral nutritional supplements. We all think there is some value of nutrition really to cope with Alzheimer's disease in terms of prevention, but by now there is no evidence, no strong evidence to recommend it when the disease has already started. So this is important to know because many people take any nutritional supplements like vitamins. That's really a challenge, and I think what we could really do as clinicians is bring the guidelines to the institutions that take care for patients and residents with dementia, so hospitals, nursing homes, daycare. Also take the guidelines to other medical societies that have somehow to do with dementia patients, like neurology, psychiatry, and so on. And what we do in everyday life is mention the guidelines at any opportunity, like medical reports, discharge letters, really refer to the guidelines to make clear that the recommendations for nutritional treatment we give are part of evidence-based guidelines.